years, I have been a believer, implementer, and an activist for primary health care. I am hopeful because the youth, our future, is fired up. Because civil society, the guardians of the welfare of the poor and the excluded, are fully engaged. I have seen people and institutions who 10 years ago did not want to hear about primary health care, and yet today they are embracing the values and principles of primary health care. I am hopeful because of what I have heard and witnessed over the last 2 days. We possess the know-how. We know what works and what we need to do. But we must never lose sight of the fact that there are millions living in our countries that yet do not share that hope. Today, we are here to reaffirm that health is not a privilege, not a commodity. It is a fundamental human right. We have come today to reaffirm our commitment to the values and principles of primary health care in the spirit of Alma Ata. Allow me to be provocative in this, the final session of our conference. If we all share the vision of health for all, why is it then that we are not there yet? What is it that is required to make it happen? And what should we be doing differently this time? First, let me suggest that it is important to have conceptual clarity and a clear vision. Let us agree, finally, that primary healthcare is an approach, a strategy for health and well-being, for human and social development, which is centered on the individuals, their families, and their communities. It is not merely the first level of care, nor is it the provision of a limited package of services for the poor. Primary healthcare calls for universal access to quality, comprehensive health services, not only curative, but for promotion, prevention, rehabilitation, palliation, and treatment of common conditions. It calls for addressing the social determinants of health. It calls for removing all types of barriers to access, including financial, geographical, cultural, and gender. And it requires state action. Without state action, there is no right to health, especially for those living in situations of vulnerability. Without state action, we cannot make progress in social cohesion. Ladies and gentlemen, I say that language matters. That is what we mean by the primary healthcare strategy. And this should be our common vision of primary healthcare. Secondly, it is important to learn the lessons of Alma Ata, namely that barriers to access must be systematically identified and broken down, and that fragmentation and segmentation of health systems and services is a recipe for failure. National governments must lead and own national processes towards universal health in coordination with partners. Universal means universal, with no excuses or half measures in providing the necessary health services for all people. And universal health cannot be attained without multi-sectoral policies, programs, and actions that address the social determinants of health. Third, the pursuit of equity in health demands strengthened social participation and community engagement. Leaving no one behind means making special efforts to give voice to those that have not been heard, those in conditions of exclusion and vulnerability, including women and children, youth, migrants, LGBTQ populations, ethnic groups, and the poor, to mention a few. The development of a people and community-centered model of care enables the participation of people and civil society as key stakeholders in this process. This is the time for innovative and creative strategies to enhance community and social participation and to enable people to make optimal choices for their own health. A key tenet of the primary healthcare approach is the provision of comprehensive quality health services where people live and work. We need a revolutionary first level of care, one that makes rational and efficient use of technology and organizational innovation, including interdisciplinary health teams with a new cadre of personnel and skills mix. A first level of care that is supported by an integrated health services delivery network, including hospitals and specialized services. A first level of care that responds to people's needs, risk factors, violence, mental health issues, sexual and reproductive health, chronic non-communicable diseases, public health emergencies and disasters, and the impact of climate change, and everything else. Ladies and gentlemen, primary health care must form a central part of the strategy for transforming health systems to achieve universal access to health and universal health coverage. And so, colleagues, we have arrived at an important juncture in the history of primary health care. We have taken time to look back, to acknowledge our achievements, and to realize our errors. It is time now to look to the future, towards the next 40 years and beyond. It is a time to call us to action, making sure that we accelerate the movement to leave no one behind. So, I want to say to governments, we ask you to fully embrace the commitments that you have made in the Declaration of Alma Ata of 1978 and in the Declaration of Astana 2018. Health is a right of the people and the responsibility of government. Let us then make it so. Assume leadership and your role as stewards of the health sector. Realize the vision of primary health care for your peoples as the principal strategy to improve health and well-being. Adopt coherent policies and regulations that strengthen and make your health systems equitable and resilient. Educate and train your peoples to build a workforce for health never before realized. Reach your people through a strong first level of care, supported with integrated health services, including hospitals. Invest in your people and your systems. Invest in health, not war. And please, please, do not reduce health to merely the access to a minimum sets of packages or essential services, when indeed your people deserve so much more. Lead, coordinate, and drive change within the health sector and in other sectors. Engage your people in this process. They will acknowledge your efforts and be grateful for it. To the youth, you are indeed our future. You are the energy that will drive change, and your future is in your hands. Engage, therefore, in the decision-making process and make your voices heard. And if you feel you're not being heard, reach higher and farther until all those that are not listening sit up and pay attention. Seize this moment, as the actions we take now will have lasting impact for your health and well-being and that of your communities. I challenge you, young people, to be involved in your communities. I challenge you to be involved in health action. I want to speak to us women. Let us continue to fight for what we know is right, to realize a vision of primary health care that addresses our needs as women, to prioritize the delivery of quality, comprehensive services that respond to the differentiated needs of women. Call on your leaders to ensure that gender is central to the decisions that are being taken in health. It is not acceptable that in the 21st century, women continue to die in childbirth because they could not receive prenatal care, or the primary care center was too distant, or because transfusion services were not available. And call on your leaders, women, to ensure that gender is central to health policy, to ensure your rights as a woman throughout the life course or as a health worker. To those of us from academia, in this, the era of mass information and communication, where policy research is often questioned and debunked, and best evidence ignored, now more than ever, you must stand up. Work even harder, invest in operational research that is context-specific and focus on the needs of our countries and on their health systems. Learn to communicate evidence, to speak truth in a manner that can be readily captured to guide and support policymakers to take the right decisions. And modify your curricula to prioritize the generation of a new workforce that will respond to the call of the Astana Declaration. To the private sector, you have an important role as health providers in service delivery, in hosting the platforms that are necessary to generate and manage critical information. You are leaders in innovation. You provide us with critical medicines and technologies that have allowed us to make leaps and bounds in health. And you are a key partner in the future of primary health care. But with this comes responsibility. Please remain engaged and committed to working with your governments and societies in advancing primary health care and universal health. You have a responsibility to your shareholders, but you have an even greater social responsibility to the peoples of this world in the decisions and actions you take. Innovate, but based on health needs. Participate, engage, and invest in primary health care. And remember that a healthy population drives economic development. To our development partners, this is a golden moment for us. We cannot live here and repeat the mistakes of the past in instigating reform processes that weaken governance and stewardship, that reduce primary health care to minimum sets of core services for the poor. Embrace the holistic vision of primary health care in partnering with our countries. Let us not fragment, segment, and dilute our collective action in support of this movement. Let us reaffirm the principles of the Paris Declaration in working around one policy, one plan, and one vision towards universal access to health and universal health coverage that is built on the promise of primary health care. Honor your commitment to align, accelerate, and account. To community leaders and peoples of this world, let us build a global community, a global movement. Let us call for a social compact where universal health is central and primary health care is the strategy. We are in a world where connection and connectivity drives innovation and social change. Remain connected, participate and engage. Promote health and well-being for yourself, your family, your community. Be accountable and hold your policymakers accountable too. Through social participation, good governance and transparency, we can collectively advance in health and development. Colleagues, let this be the moment where we come together to launch and drive this global movement to ensure that the right to health becomes a reality in the 21st century. Let us reaffirm our commitment to action in the quest for equity in health and the achievement of all of the SDGs. Let us change the course of history and set us on a trajectory whereby 40 years from now, future generations will look back and say, yes, the vision was solid and the result was strong. Ladies and gentlemen, there is no other way. Primary healthcare is smart, primary healthcare is right, primary healthcare is the foundation of universal access to health and universal health coverage. The basic tenets embodied in Alma Ata continue to be both valid and relevant to our times. These are the same values and principles that must now be the oil that keeps the lamp of Astana burning. Primary health care, the time is now.